So I have like a suture over here that was done, and it was kind of botched, but it was like not very well done by a doctor, and obviously doesn't look nice. So suture can also not be nice, and so obviously if you're not very familiar with the procedure, I wouldn't go after that. So I was glad that they talk about that because I've been talking about how it's better, and it's sad. It's funny because everywhere that you hear in communities, they always talk about suture, 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 but yet staple is way easier. I can give that to a 4-year-old and they'll know how to do it because it's really ham and shoot. It's very easy. You just apply it, just like a suture when you staple a piece of paper. Just you're stapling your skin. So that's how easy it is, and you don't need the freezing that you need and stuff. And just like suture, it's not a sterile technique, it's a aseptic technique. Obviously, if you're closing, then you're starting to try to be a little bit cleaner. But the staple seems to work a little bit better. Anyway, that's why I recommend for that one, and they recommend here too. On the dressing, they're pretty cool. They talk about the wound environment, the moist wound environment, which we talk way in the past. They talk about a clean protective wound bandage. They say that it doesn't show any improvement and stuff. Um, on that one, I was sure I'm glad with that, but uh, they talk about we talk about that before in the gauze that I find doesn't kind of you know hold very well and stuff versus the other. They say there's no studies that have shown that one is worse than the other one, but it's more by my experience that if you have gauze and you're in wood, like when I used to be like ski patrol and stuff, and you have that in the trees and stuff, branch just accumulate. The bondage doesn't stay as well. So why don't you use like the real stuff? But well they recommend here for suture is that where was that? So they say no additive should be added to the irrigation fluid, so we don't need to put iodine stuff unless you have like um, unless you have rabies, which is very rare. So even they talk like you're in the middle of the jungle stuff. Just irrigate no more than a liter. There's some studies show that too much is sometimes doesn't improve at a certain pressure, depending of what kind of contaminant it is in the wound. And tissue adhesive, so basically the glue, they recommend as well here, and they when they talk about dressings, the one that they recommend is a little bit what I'm talking about first, but there's not been that great studies that shows that one is better than the other one, but so they say, but they would still recommend those kind of dressing first, then a wet to dry. So that means a gauze that you wet and then you remove, and then ointment, antibiotic ointment. On that one, I was kind of confused. Well, not confused, but a little bit disappointed because in the same journal, but I think one before or after, they did a great article on honey and all these antibacterial stuff and everything. So why would I carry antibiotic, which has petroleum in it? Is worse for the wounds, create too much moisture, especially if you have a big wound that can make you resistant to those antibiotic. But yet on honey, there's none of those things. So I was a little bit disappointed that they didn't talk about that one for that part, as well as the wet to dry. I mean, I obviously I'm again I try not to have any gauze, but if you have nothing else, gauze is like, I mean, is my backup in my 2 month first aid kit, but is it is to be used with caution, I guess. should say. But yeah, it's a second choice. The problem that I have with a lot of other people that do stuff is they're first to go versus you can carry in. Again, we talked in the past the reason of the gauze versus the 21st century dressing is that um, the problem with gauze is that you have to have too much. Like when you do it wet to dry, we're not talking about one dressing. And remember when I did my thumb video series, I did 4 dressing in 1 month. If you're doing wet to dry, that's 2 or 3 dressings every day for a month or 2 months. So the wet to dry sure works, but you're talking about a lot of supplies. So yeah, if you're being in the middle of nowhere, that would be a way to go, and that's all you have, and you don't have those 21st century dressing. Wet to dry is better than nothing as long as the wounds stay wet. But problem with dressings is that the thing you have to discard them, you have to dispose of them, so somehow you have to either burn them or they're waste, right? So, and you have to have a lot of them. So anyway, I wanted to do a quick video to shout out on that article, which was great and great review, and as well as kind of support some of the stuff that I've been saying and everything. And so yeah, and it's been a long time I didn't do a medical video, so I thought I was doing a little one there and too. And check out the other one too on honey. It's very good at explaining all why it works on wounds and stuff, and not too scientifically. Like it's sure there's scientific words, but it's not too out there. And they give some good use on it too. Like now I'm going to be using it as eye drops. Because there's some literature that supports that as well. So we'll talk to you soon.